infratemporal fossa. So by the name you can say that the fossa lies below the temporal bone or temporal area of our cranial vault. All right, so that fossa lies in there. This right here, you can see very complicated structure. All right, there is a lot of contents in those fossa also, and boundaries are very rough. All right, so we will try to uncomplicate it just like our channel says. So let's begin. So we have to make what? A four-faced inverted pyramid. Keep that in mind, keep that in head. We will be making a four-faced inverted pyramid. All right, so four-faced means four borders and the superior border, because there will be a inverted pyramid. All right, so let's begin. And this right here makes lateral wall, and that is made by the ramus of mandible. And this right here makes medial wall, and that is made by the lateral pterygoid plate of pterygoid process of sphenoid bone, pharynx, tensor veli palatini. You can you can imagine this. How can you imagine this? Is that like if you are facing towards this screen, all right? If you are facing towards this screen, you can imagine there is laterally a ramus of the mandible, and medially there are medial structures inside us, right? So that inside us is pharynx obviously, and tensor veli palatini is a muscle, and then lateral pterygoid plate, that is also the inside structure of the sphenoid bone. All right, so that is how you can imagine. And this will make the anterior wall, and that is made by posterior and infratemporal surface of the maxilla. And this is the posterior wall made by tympanic plate, mastoid and styloid process. All right, so that is how four different walls are formed. All right, so there will be superior wall, and this superior wall will be formed by the greater wing of sphenoid bone and temporal bone. So that is how we make the walls, and this is how a infratemporal fossa is made. And talking about the contents of these fossa, there will be muscles. Muscles are the muscles of mastication. You can remember the muscles of mastication, and that are lateral pterygoid muscle, medial pterygoid muscle, and temporalis muscle. So these are the muscles that will be in there, and there will be vessels. All right, so these vessels are maxillary artery. You can remember, like, it is very logical, isn't it? Because there is infratemporal fossa. This is all in the head. All right, so that is the maxillary artery, pterygoid plexus, and the nerves. Talking about nerves, this can be like mandibular nerve and chorda tympani, lesser petrosal nerve, and then otic ganglion. So that is how our infratemporal fossa completes. It seems very easy by like this. All right.